So implants have a very high success rate. It's in the high 90s. But sometimes an implant will develop issues with it. These issues could range from just having slight redness in the tissues around the implant, or it could be deep pockets like you get around teeth. And further, you could develop pus and frank infections with it. So it's a gradual stage, and that's how you know you have peri-implantitis. Sometimes, just like with periodontitis, which is inflammation around teeth, you may not know that until you see a clinician like a dentist or an oral surgeon. And so it's very important, those maintenance appointments, even if you have only implants, it's very important to go to those appointments where we look around the tissues and we kind of see the color, the texture, and this pocket, and see if everything is in good health. And if you catch it early, there's definitely benefits for being able to treat it early. And the treatments can be as simple as injecting an antibiotic solution around it so that you get, so that it resolves the issue. And we can also look at the cause as to why it's happening. Maybe it's because the bite is heavy in that area. Maybe because the brush is not getting around that area. So those are the things that we can address. So if it's around a tooth inflammation, it's called periodontitis, and around an implant, it's peri-implantitis. In the worst case scenarios where you have loss of bone and loss of structure, which is not going to support the implant, then we have to remove the implant and replace it. And that's a very successful procedure as well, where we can regenerate the bone and the gum tissue that was lost and then place a new implant at that site. Being an oral surgeon, we get sent patients. I see patients from various practitioners who have developed problems. So we just see a lot of them. And when you see something, a lot of something, then you're able to treat it better as well, because you know how it presented and then what kind of solution worked at that time. As oral surgeons, as specialists, as secondary care, so you have your primary care and secondary care, we feel that we're just more experienced to address that. We just have seen more cases and we have more experience in addressing this issue.